Can you talk a little bit about the artistry of what makes a hairline natural looking and undetectable that someone would look at it and say, oh, well, I wouldn't have thought twice that this person had a procedure done?
Well, I think one of the main things that you're trying to do when you're restoring a hairline is you're trying to recreate what Mother Nature gave you to begin with. Trying not to get too aggressive, trying to keep a nice symmetry on both sides, and having what we call a blended density, where an initial leading edge of the hairline is very soft and it's nothing but single-haired follicular units. Sometimes patients will come to see me and they've had work done elsewhere, and there's a lot of 2- and 3-haired grafts in the leading edge of the hairline. Now sometimes that can give the appearance of a very strong hairline, but it's not a natural appearance, and that's the thing they complain about. They say it looks a little pluggy, it doesn't look natural. And so we'll bring them in and soften it up with, blending the 1-haired follicular units in there, and it makes it much nicer. It puts a nice softening on the hairline.
Gotcha. And how important is the pigment of someone's skin and then the color of the hair and the hair texture? How does that all play into making it look natural?
I mean, it's obviously, it can be more challenging when you have a patient that's got dark hair and light skin because the scalp stands out so much. If you have a patient that has, light hair and light skin, it doesn't tend to be as much of an issue. Where the hair can, you could potentially use a little larger, grouping of hairs, and it wouldn't stand out as much as if you had a patient that had dark hair and very light colored skin.
Gotcha.
A 2- or 3-haired graft would jump right out, and it would be very obvious. So those are just components of planning a surgery and looking at how you would approach it.